Doctors, who's the dumbest patient you've ever had? Story 1. Working as a vet, I've seen my fair share of odd cases and curious behaviors from the animals I treat. And while most of the cats and dogs I deal with are sharp little critters, the same can't always be said for their owners. I mean, don't get me wrong, most pet parents are great, but then there are the ones who leave me questioning how they manage to dress themselves that morning, let alone care for a living, breathing animal. Here are some of my favorites. One day I had a client tell me, "My dog doesn't need heartworm prevention. We live in a gated community." For a moment I was stunned. I blinked at them, wondering if they were joking. They weren't. So I had to gently explain that mosquitoes, which carry heartworm, don't care about your HOA or your fancy gate code. They'll crash the party regardless. But nope. They were convinced their little patch of suburbia was mosquito-proof. Okay then. Then there was the woman who asked me, "After my cat is spayed, can she still have kittens?" I paused, thinking, did I hear that right? For the uninitiated, spaying involves removing the uterus and both ovaries. It's like taking out the engine and asking if the car can still run. I broke it down for her in simple terms, and she still looked skeptical, like I was withholding some secret reproductive magic. And how could I forget the self-proclaimed internet experts? I was on the internet for 2 hours researching seizures, so now I know more about seizures than you do, one man announced smugly. I smiled politely and resisted the urge to say, "Oh, totally, because those 2 hours on YouTube absolutely trump my 4 years in vet school, year-long internship, and 15 years of treating animals. Please enlighten me, Professor Google." Another favorite is the non-compliance crowd. This guy came in frustrated, saying, "My dog isn't getting any better." I asked if he'd been giving the prescribed medication. He sighed dramatically and said, "No, he doesn't like taking pills." Well, buddy, I don't like going to the gym, but sometimes you gotta do things you don't enjoy. Not giving the meds, but expecting a miraculous recovery? That's like not watering a plant and being shocked it didn't thrive. Then there was the anti-itch medicine debacle. A woman told me, "The medicine worked great for a while, but then it stopped working." I checked her file. I'd given her a month's supply, 3 months ago. When I pointed this out, she looked at me blankly, as if I just told her 2 + 2 = 5. And those are just the ones I remember off the top of my head. There are so many bizarre conversations and head-scratching moments that I've honestly stopped keeping track. At the end of the day, I remind myself I'm here for the animals. They're the ones who deserve my patience. They're humans. Well, let's just say I take a deep breath before I walk into each room and hope for the best. Story 2. I'm not a doctor, but I work in the medical field, and let me tell you, some patient encounters leave a lasting impression, sometimes for the wrong reasons. Case in point, this one patient who managed to completely derail an otherwise normal day with her one-of-a-kind blend of personal quirks and social awkwardness. It started with her insisting that her diabetes was different from everyone else's. She flat out declared that insulin didn't work for her personally, as if diabetes were a custom-made condition that bent to her will. I tried to steer the conversation back to science and explain how diabetes management typically works, but she wouldn't have it. Nope. She was convinced her body defied basic biology. And, as if that wasn't enough to deal with, she decided to make our poor medical student her next target. The student was a young, eager, bright-eyed type, the kind who still believed in the power of kind words and optimism. She was taking the patient's history, trying her best to stay upbeat and professional. At one point, the patient mentioned it was her 7-year anniversary. Naturally, the student perked up and said, "Oh, congratulations!" The room went silent for a second before the patient dropped her bombshell. "It's the 7-year anniversary of the day he left." She said it with this deadpan tone that sucked the air out of the room. The student's face turned beet red, her eyes wide as dinner plates. She stammered an apology, completely mortified, while I sat there thinking, why, lady? Just why? The whole thing was so unnecessarily awkward. How was the student supposed to know? It felt like the patient had set up this conversational landmine just for the fun of watching someone step on it. Meanwhile, I was torn between irritation and secondhand embarrassment for the student, who kept trying to recover and get through the rest of the appointment without making eye contact. Afterward, the student came to me looking utterly defeated. "I didn't know," she kept saying. How was I supposed to know? I reassured her that she'd done nothing wrong and that some people just seem to enjoy making situations uncomfortable for no good reason. But man, I felt for her. It was one of those moments that sticks with you, not because of any groundbreaking medical insight, but because it perfectly illustrates how unpredictable and awkward human interactions can be. Story 3. Working in healthcare means you hear and see things that would leave most people speechless. Sometimes you're shocked, other times you just shake your head. Here are 2 stories that left me wondering how people even function. The first was a lady who came in absolutely distraught. She was in tears, saying she couldn't afford her medications anymore. Naturally, I was sympathetic at first. Money troubles are no joke. especially when it comes to health. But as we talked more, she let it slip that she was spending about $200 a day on candy. Not just a bag or two from the dollar store. Half an ounce of high-end candy daily. My brain did the quick math. That's $6,000 a month on candy. I tried to delicately ask if maybe cutting back on the sweets could free up some cash for her medication. She looked at me like I'd suggested selling a kidney. But I need it, she said, dead serious. Look, I get that everyone has their vices, but prioritizing a sugar habit over life-saving medication? That's next-level bad decision-making. The second story, well, this one still haunts me. A 20-year-old guy came in complaining of feeling sick. Fever, fatigue, the works. We ran some standard tests and couldn't pinpoint anything major at first. He didn't mention anything unusual during the exam, so we sent him home with instructions to rest and follow up if things didn't improve. Fast forward a few days and his wife shows up. She's panicked, saying, "He didn't tell you about his problem?" Turns out the guy's banana was literally rotting. Necrotic. Blackened, decaying, like something out of a horror movie. I was floored. How do you not bring that up during a medical visit? That's not a let's wait and see kind of issue. That's a drop everything and call 911 inches situation. We rushed him back in, and sure enough, it was as bad as she described. It was necrotizing fasciitis, a fast-moving, flesh-eating infection. The poor guy needed emergency surgery, and honestly, he was lucky to still be alive. When I asked him later why he didn't mention it, he shrugged and said, "I didn't think it was important." Not important? Your literal manhood is falling apart, and you thought, nah, probably nothing. Story 4. This sounds like something straight out of a TV show, but apparently, life sometimes imitates art in the most ridiculous ways. One of my sister's friends, who's a doctor, told us about a teenage girl who came into the ER complaining of severe abdominal pain. Of course, the ER team started running through the usual questions to narrow down what could be causing it. When the topic of pregnancy came up, the girl was adamant. There was no way she could be pregnant. She swore up and down that it wasn't possible. Now, ER doctors hear this kind of denial all the time, so they proceeded with their tests just to be thorough. And wouldn't you know it, pregnancy test came back positive. When the doctor gave her the news, the girl's reaction was a mix of shock and total denial. "That's not possible," she kept saying, genuinely stunned. At this point, the doctor decided to dig a little deeper. "Have you been sexually active?" she asked. The girl hesitated, then admitted she had been with her boyfriend. So the next logical question followed. What kind of birth control are you using? And this is where things took a turn into the absurd. The girl confidently replied, "Apples." The doctor, momentarily thrown off, clarified, "You eat apple?" The girl nodded. "Yeah, I eat an apple after we do it. It's supposed to prevent pregnancy." Now, I don't know if she came up with this on her own, or if someone fed her this ridiculous notion. No pun intended. But apparently, she truly believed that munching on an apple post-relationship was as good as any contraceptive. Maybe she thought it was some sort of natural remedy, like a magical fruit-based barrier method. Whatever her reasoning, it obviously wasn't working. The doctor had to sit her down for a crash course in reproductive biology, explaining that apples, while healthy, are not and never will be a form of birth control. I can only imagine how awkward and uncomfortable that conversation must have been. Story 4. During my time in PA school, I had this unforgettable encounter that left me both baffled and laughing later. A guy and his very pregnant wife came in for what I thought was going to be a pretty routine conversation about a vasectomy. Easy enough, right? I sat them down, ready to explain the procedure and answer any questions. But before I could even get started, the guy hit me with his first question. "Can I keep them once you finish the surgery?" It took me a second to process what he'd just said. "Keep them?" I blinked at him, unsure if I'd heard wrong. His wife looked equally horrified and embarrassed, burying her face in her hands. That's when it clicked. This guy thought we were going to literally chop off his testicles during the procedure. Like, snip snip, bag them up and hand them over. I had to fight to keep a straight face while I reassured him. No, that's not how a vasectomy works," I explained. "We're just cutting and sealing off the tubes that carry sperm. Everything else stays exactly where it is." The relief on his face was instant and dramatic. He actually leaned back in his chair and sighed like he'd just dodged a death sentence. "Oh, thank God," he said. His wife, who had been mortified up until this point, finally started laughing. After going over the rest of the procedure, how it's done in the office with local anesthesia and doesn't involve any major downtime, he seemed a lot more at ease. But man, I couldn't stop thinking about how terrified he must have been walking into that appointment, imagining the worst. Story 5. I'm an eye doctor, and let me tell you, I've got stories. Stories that would make anyone with a shred of common sense shake their head. There are two types of patients I see regularly that make me question humanity's ability to prioritize their own health. First, there are the folks who absolutely abuse their contact lenses. I'm talking about people who sleep in them, don't clean them properly, or stretch a one-day disposable lens to its breaking point, literally. Then there's the second group, people who refuse to wear safety glasses when doing anything remotely dangerous. You'd be amazed how much trouble they could avoid with a $10 pair of goggles. Let's start with the contact lens abusers. These are the people who think, hey, what's the worst that could happen if I just leave these in overnight again? Spoiler alert, the worst that could happen is a corneal infection. I had a patient just last week with 20 scars on his corneas from repeated infections. That's not just a new record for me. It's an appalling testament to how little care people sometimes give to their vision. It's not hard to take your lenses out at night, clean them, and replace them as recommended. It's cheaper too than paying for endless office visits where I'm trying to save your vision from your own laziness. Then there's the safety glasses issue. I can't count how many times I've had to fish bits of metal or wood or God knows what out of someone's eye. Just last week, a patient came in after a piece of metal from a wire brush had penetrated his eyeball. And get this, he thought it was a brilliant idea to pull the piece out himself and then wait 3 days before coming to see me. By the time he walked into my office, he had a severe eye infection called endophthalmitis. If untreated, that infection can cost you your eye permanently. He needed emergency surgery, and honestly, it was sheer luck that we managed to save his vision. Another patient? He got hit in the eye with a piece of metal moving so fast it went all the way to the back of his eye, lodging itself in the vitreous. When I looked, there it was, floating ominously like some sci-fi nightmare. He also needed immediate surgery. Both of these cases, and countless others, could have been avoided if these guys had just worn a pair of safety glasses. It's not rocket science, people. The thing is, losing your vision, or even just a portion of it, is a life-altering experience. Your world gets smaller. Tasks you once did without a second thought become monumental challenges. And for what? A little convenience in skipping safety measures? The excuse of being too tired to take your contacts out? Come on. Story 6. I used to work as a nurse in the ICU, and let me tell you, I've seen my fair share of strange situations. But this one stands out in my memory for how bizarrely sweet and completely clueless it was. It wasn't a patient who made this one memorable, though. It was their family. One day during visitation hours, this family walks in, carrying one of those plastic bakery containers from the grocery store. You know the ones. Half a dozen cupcakes nestled inside, the frosting a little smudged from the lid. This wasn't unusual. Families often brought us food as a kind gesture, and we appreciated it more than I can say. ICU work is tough, and a surprise donut or cookie could make your day. So at first, I figured this was just another one of those moments. But no. It was something else entirely. I walked into the patient's room to give an update and maybe thank them for the cupcakes if they offered them. While we were talking, they casually mentioned it was the patient's birthday. I thought, wow, that's really sweet. Even with everything going on, they're here to celebrate with her. I admired the effort, honestly. The patient, after all, wasn't in great shape. She was on a ventilator, unconscious and sedated with IV medications, a situation not exactly conducive to a festive birthday party. Then things took a turn. One of the family members handed me the cupcake container and looked at me expectantly. I stared at it for a moment, thinking, oh, maybe they brought this as a thank you for the staff, but their expressions didn't match that vibe. Finally, someone said, aren't you going to feed them to her? Feed them. To her. It took me a second to process. My mind raced as I glanced at their loved one. Motionless, ventilated, and absolutely unable to eat so much as a crumb, let alone a cupcake. It hit me. They genuinely thought I could somehow feed cupcakes to an unconscious, intubated patient. I tried to explain as kindly as possible. I pointed out the breathing tube in her throat and the fact that she wasn't even awake. I mentioned the IV sedation keeping her under and gently explained why cupcakes, no matter how lovingly brought, weren't an option right now or anytime soon, honestly. Their faces went from confused to mildly embarrassed. Oh, one of them said. We didn't realize. They meant well, truly. But it was one of those moments where I had to question how much people actually understand about ICU care. They were lovely folks, kind, thoughtful, and clearly devoted to their loved one. But they were also completely out of their depth. I felt for them, though. It wasn't malice or neglect. It was pure, unadulterated ignorance. I handed the cupcakes back and suggested they enjoy them for her. Maybe light a candle and celebrate quietly while she rested. They agreed, a little sheepishly, and I left the room shaking my head, smiling despite myself. Story 7. During my medical school rotations, I encountered plenty of moments that were equal parts baffling and educational, but this one definitely takes the cake. It was a day like any other, and we had a patient come in complaining of abdominal pain. Nothing too out of the ordinary, until the conversation took an unexpected turn. As part of my routine questions, I asked her, "Is there any chance you could be pregnant?" She confidently shook her head and said no. Her reasoning? "I'm a sapphic," she declared, as if that was the ultimate trump card. Fair enough, I thought at first. People know their own lives better than I do, right? But here's the thing about medical training. You don't just take answers at face value. My attending doctor wasn't about to skip a pregnancy test just because of her sexual orientation. So, along with the usual blood work, we added a pregnancy test to the order. Just to rule it out, you know? And wouldn't you know it? The test came back positive. I remember staring at the result for a moment, feeling like someone had just pulled a prank on me. I went back to the patient, trying to tread lightly, and asked, "Are you absolutely sure you haven't had any interactions with a man recently?" She tilted her head, looking genuinely puzzled, and then answered, "Well, yes, I have, but I'm sapphic. How could I be pregnant?" I froze for a second, trying to decide if she was messing with me. She wasn't. She was dead serious. Before I could figure out how to respond, my attending chimed in with the most memorable line of the day. "Honey, the sperm doesn't care if you're a sapphic." It was one of those moments where I had to work hard to keep a straight face. She looked completely blindsided by this revelation, like the rules of biology had personally betrayed her. I went on to explain gently that while her identity as a sapphic was absolutely valid, biology doesn't exactly play by the rules of identity politics. If you have unprotected contact with a man, pregnancy is always a possibility. The patient eventually processed what we were saying, and while she was still clearly stunned, she started asking more questions about her situation and what came next. To her credit, she took the news with grace, if not a bit of lingering disbelief. That day was a stark reminder of how much education about basic biology is still needed. Even in adults, it also taught me the importance of never assuming that a patient's self-assessment is the whole story. People don't always connect the dots the way you'd expect, and as a medical professional, it's our job to fill in those gaps without judgment. Story 8. This one stuck with me, not just because it's wild, but because it's one of those stories that makes you question how people's decision-making circuits get so wildly out of tune. It was a morning shift in the burn unit, and the moment I walked in, the air was buzzing with chatter about a new patient who'd been life-flighted in overnight. The details sounded so absurd that at first I thought someone was pulling my leg. But nope, it was all too real. The patient was a 22-year-old woman who had been out at a bar the night before with a group of friends. She'd managed to rack up a $200 tab, which, according to her, she didn't have the money to pay. Already, you're thinking, okay, not great, but it happens. It's what came next that makes you want to facepalm so hard it leaves a mark. Her friends, and I use the term loosely here, came up with what they must have thought was a hilarious solution. They told her they'd cover her tab if she let them pour Bacardi 151 all over her and light her on fire. And here's the kicker, she agreed. Why? Because she didn't know alcohol was flammable. Let that sink in for a moment. This wasn't some random one-off dare. This was a full-blown human experiment in bad decisions. These people doused her with one of the most flammable liquors you can buy, and true to their word, set her ablaze. Predictably, things went downhill fast. The fire caught and spread before anyone could react. By the time someone had the sense to put her out, she had sustained severe burns over a significant portion of her body. The flight crew got her to us in the burn unit, where she became something of an infamous figure for the day. The medical team jumped into action to stabilize her, manage her pain, and assess the extent of the damage. Burn care is grueling. Debridements, skin grafts, constant monitoring for infections. But there's also a psychological toll. For someone who made a split-second, life-altering decision, the weight of what happened doesn't usually hit all at once. It creeps in. I couldn't help but think about the dynamics of her group of friends. What kind of people come up with an idea like this? And what kind of environment makes someone think, sure, this seems like a good trade-off? It wasn't just poor judgment on her part. It was an entire ecosystem of recklessness and peer pressure that led to this moment. As the days went on, she began to grasp the severity of her injuries. Burns aren't just a physical trauma. They can leave deep emotional scars. There's the realization that healing won't erase the scars, and that life may never quite look or feel the same again. Story 9. This story is one of those moments in medicine where you realize just how much interpretation matters, especially when giving instructions. It involves a medication called Flagyl, metronidazole, an antibiotic that comes with a very clear and serious warning. Don't drink alcohol while taking this drug. If you do, the combination can cause severe nausea, vomiting, and other unpleasant symptoms. It's such a common warning that most healthcare providers can rattle it off without a second thought. One of my coworkers prescribed Flagyl to a patient and, as usual, gave her the standard advice. Don't drink while you're on this medication. Pretty straightforward, right? Well, apparently not. Fast forward a couple of days, and the patient shows up in the ER looking like she's been through the ringer. She's severely dehydrated, pale, and clearly miserable. Naturally, everyone's first thought was that she'd ignored the instructions, indulged in a drink or two, and paid the price. But when the attending started asking questions, her story took a completely unexpected turn. It turns out she had taken the no drinking rule so seriously that she stopped consuming any liquids at all. No water, no juice, no soda, nothing. She genuinely believed that the directive to avoid alcohol extended to all drinks. For 2 whole days, she avoided liquids entirely, convinced that taking even a sip of anything would lead to violent vomiting. Unsurprisingly, this led to severe dehydration, which is what brought her to us in the first place. When the medical team pieced together what had happened, there was a collective mix of exasperation and sympathy. She wasn't being intentionally reckless or ignoring medical advice. She was just too literal in her interpretation. To her, don't drink meant exactly that. Nothing to drink, period. After she was stabilized with IV fluids and electrolyte replacement, we made sure to sit down with her and carefully explain the actual meaning of the instructions. Yes, you can drink water and you absolutely should. We went over it several times to ensure there was no room for misinterpretation. She nodded, clearly embarrassed but also relieved to know she hadn't been poisoning herself by drinking water. The incident became a bit of a running joke in the department, not at her expense, but as a reminder of how important it is to be crystal clear when giving instructions. What seems obvious to a healthcare provider might not be so obvious to a patient. It was a lesson for all of us. Never assume that people will automatically understand what you mean, no matter how straightforward it seems. Story 10. I'll never forget the day a man showed up in my office with a problem and an attitude to match. He wasn't one of my regular patients, but he came in because his usual dentist was closed. Fair enough, emergencies don't keep office hours. The issue? He had superglued his dental crown back onto his front tooth, #10, and unsurprisingly, it wasn't seated correctly. The crown was stuck at the wrong angle, which meant he couldn't close his mouth properly. The look he gave me when I walked into the room was something else. A smug, half-cocked smile that screamed, "I dare you to fix this!" Before I could even start explaining why superglue was a terrible idea, he cut me off saying, "Okay, smart guy, what should I use to put a crown back on?" The sarcasm in his voice was palpable. I didn't miss a beat. "A dentist," I shot back. My assistant, bless her, couldn't keep it together. She bolted out of the room, and a moment later I could hear her absolutely losing it in the hallway. Meanwhile, my patient was just sitting there, still unable to close his mouth fully, glaring at me like I was the unreasonable one in this scenario. Now this guy wanted me to fix it, which meant not only removing the mangled crown but also creating a new one. That's where the conversation took a more serious turn. As always, I reviewed his medical history to ensure it was safe to proceed. He'd already filled out the form when he checked in, but I always ask in person too because, trust me, people leave things off. Sure enough, when I asked about any recent heart procedures, his response stopped me in my tracks. "Oh yeah," he said casually, like he was mentioning last weekend's football game. "I just got out of the hospital 2 days ago. They put in 4 stents after I had a major heart attack." I blinked. "And you didn't think to include that on your medical history form?" He shrugged. "You're a dentist. You don't need to know that." It took everything in me not to drop my tools right then and there. I explained to him calmly somehow that yes, as a dentist, I absolutely did need to know that. Dental work can involve bacteria entering the bloodstream, stress on the body, and potential complications that could wreak havoc on a heart already in recovery. There was no way I was going to touch him without a medical release from his cardiologist. Of course, he wasn't happy about that. He grumbled and argued, but I stood my ground. "Look," I told him, "your mouth is attached to the rest of your body. I'm not taking any risks, and I'm certainly not about to call an ambulance because you want me to rush this." Eventually, he left in a huff, still flashing that smug but irritated half-smile thanks to the misplaced crown. I could hear him muttering as he walked out, but frankly, I didn't care. I'd done my job, and I wasn't about to let him turn his poor judgment into a medical emergency on my watch. Story 11. Working as an embryologist, you encounter some wild situations, but this one still stands out as the most baffling. It was a routine day when a man came in for a semen analysis as the first step in starting IVF with his wife. Nothing unusual there, just another couple seeking help to grow their family. I gave him the standard instructions, handed him the collection cup, and directed him to the private room. Simple enough, right? Well, that's what I thought. A little while later, he rang the bell to signal he was done. I headed over to retrieve the sample, only to be met with something I never in my life expected. Sitting in the cup wasn't what we'd requested. It was a literal turd. Yep, he had pooped in the collection cup. For a moment I stood there in stunned silence, staring at the cup, trying to process what I was seeing. My first thought was, did he misunderstand the instructions? Is this some kind of joke? But when I looked at him, it was clear he was completely serious. He handed me the cup with the confidence of someone who thought he had done exactly what was asked of him. I carefully and a bit awkwardly asked him what had happened. His answer floored me. He and his wife genuinely had no idea how reproduction works. They'd been trying to conceive, but with absolutely no understanding of the basics. Somehow, they thought IVF was the solution to a problem they didn't realize they could solve themselves. If only they had the faintest clue about the birds and the bees. After a deep breath, I sat him down and explained, in the most professional way I could muster, what the actual process for a semen analysis involves. I broke down the basics of conception and clarified why what he provided wasn't exactly useful. To his credit, he was mortified. He kept apologizing and insisted he thought that's what we needed. I assured him that he wasn't the first person to be confused, though inwardly I was screaming. But this is a first for me. Later, I found out the couple had struggled with fertility simply because they didn't know how to have sex properly. Or at all, really. They weren't dealing with infertility in the traditional sense. They were battling a knowledge gap so massive it had completely derailed their efforts to start a family. Unfortunately, this wasn't the only time I encountered such a case, though it was by far the most memorable. It was a stark reminder that assumptions about basic knowledge can sometimes lead to shocking misunderstandings. Fertility work often involves science, precision, and biology, but every now and then, it also requires a bit of gentle, eye-opening education. Story 12. Working as an ED tech, you think you've seen it all, but then a patient comes along and raises the bar, or lowers it, depending on your perspective. This particular guy came in with a classic, no doubt about it case of gonorrhea. You name the symptom, he had it. We got him treated, provided clear instructions about when it would be safe to resume intimate activities, and sent him on his way with medication and a little handout on sexual health. Seemed like a routine case wrapped up neatly. Oh, how wrong I was. Later that night, I was working the front desk when the phone rang. On the other end was our gonorrhea patient, absolutely screaming in pain. I could barely make out what he was saying through the shouting, but the words Everclear and burning stuck out. My stomach sank as he started explaining what had happened. Apparently, this man just couldn't resist the urge to get frisky with his girlfriend, despite our very clear warnings to wait until the treatment had run its course. So, in what can only be described as a Hall of Fame level of bad decision-making, he decided to take matters into his own hands. He grabbed a bottle of Everclear, one of the strongest alcohols you can buy, and poured it directly onto his penis and anus, thinking it would terminate the germ. Yes, you read that right. He thought Everclear was a DIY disinfectant for STDs. Needless to say, this genius move didn't kill the gonorrhea, which was already being taken care of by the prescribed antibiotics, but it did manage to chemically burn through his urethra. He said the pain was immediate and unbearable, and now he could barely urinate. At that point, he decided to call us, not for advice, mind you, but to complain that his home remedy hadn't worked. We dispatched an ambulance to his location because, frankly, it sounded like he was in serious trouble. By the time he was back in the ED, the damage was clear. He had done such a number on himself that he ended up needing a urethroplasty, a surgical procedure to repair or reconstruct the urethra. I'm talking long-term recovery, potential complications, the whole 9 yards, all because he thought Everclear would be a quick fix. The kicker? When asked why he didn't just wait like we advised, he shrugged and said, "I didn't think it'd be that big of a deal." Story 13. Well, let me tell you, as a nurse, you see all kinds of things in the ER, and some stories just stick with you. This one, though, is a classic. A real 2-for-1 deal that I still chuckle about when it crosses my mind. So, the day starts like any other. A steady stream of patients, some routine, some not. In walks this guy clutching his hand, blood seeping through a hastily wrapped towel. Turns out he'd managed to stab himself in the palm. Naturally, we ask how it happened, and, trying to play it off like it wasn't a big deal, he admits he was wrestling with an avocado. Yep, you heard me right. The poor guy was trying to get the seed out. Instead of using a spoon or one of those fancy gadgets, he decides the best method is to stab the seed with the tip of a knife while holding the avocado in his other hand. You can guess how that went. The knife slipped, went straight through the fruit, and lodged itself in his palm. We patch him up, and honestly, we've all seen enough to know that accidents happen. But the funny part of this tale hadn't even unfolded yet. See, one of the doctors who treated this guy goes home that night, and over dinner starts telling his wife the story. "Can you believe someone would try something so dumb?" he says, grabbing an avocado to reenact the scene for dramatic effect. Well, irony's got a sense of humor because, wouldn't you know it, he decides to demonstrate the exact way the patient was holding the avocado, knife and all. You can probably see where this is going. The knife slips, just like it did for the patient, and goes right into his own hand. Right there, in his own kitchen. I wasn't there, but I can only imagine the look on his wife's face. A mix of horror and, "You've got to be kidding me." The next day, word gets around the hospital. Now the doc's trying to play it cool, but we all know what happened. He becomes the guy who turned a cautionary tale into a hands-on experience. For weeks, maybe months. Every time he walked into a room, someone would ask, "Hey doc, need any help with your avocados?" And trust me, he never lived it down. Story 14. Let me tell you a story my cousin, a physician, once shared with me. It's one of those moments in medicine where you can't help but shake your head and laugh. After the fact, of course. So my cousin is prepping a patient for a procedure. You know the drill: reviewing medical history, double-checking allergies, making sure all the boxes are ticked before they head into the operating room. The patient, calm as can be, suddenly pipes up, "Oh, I just remembered. I'm allergic to latex gloves." Well, that changes everything. Procedures involving latex can be dangerous if someone truly has an allergy, so it's all hands on deck. The team scrambles to review the room and materials, making sure everything is latex-free. Gloves are swapped out, and every precaution is taken. It causes a bit of a delay, but safety first, right? The procedure goes off without a hitch, and later, during recovery, my cousin sits down with the patient to get to the bottom of this new allergy. After all, something like that should have been documented long before now. He asks why it had never come up in previous medical history. The patient gives him a blank look, then casually says, "Oh, I didn't think it mattered before. I just don't like the sound of latex gloves snapping or how they feel on my skin." Now, if you've ever seen a doctor at a loss for words, it's a sight to behold. My cousin, doing his best to keep his professional composure, calmly explains the definition of an allergy. He points out that an allergy is an immune response: hives, swelling, trouble breathing, not a dislike for something's texture or sound. The kicker? The patient was under anesthesia the whole time, completely out cold. No chance of hearing the snap or feeling the gloves against her skin. My cousin stares at her, probably wondering how much time and effort had just been spent chasing down a non-existent issue. The patient, completely oblivious, just shrugs it off, saying, "Well, it still bothers me." Story 15. Let me tell you, some stories from the medical world stick with you, not because they're funny or heartwarming, but because they're the kind of jaw-dropping, "What were you thinking?" moments that make you wonder how people can be so reckless with their health. This one is a prime example. We had this patient who'd been going through chemo. Now, anyone who's been through it, or seen a loved one go through it, knows how grueling the process is. It's exhausting physically, mentally, and emotionally. For this patient, though, the end was finally in sight. They'd finished treatment, and their port removal was scheduled for 2 weeks out. That's the kind of thing we handle in a controlled, sterile environment to avoid complications. But apparently, waiting wasn't on their agenda. One day, we get the call. This patient had decided to take matters into their own hands. They figured, why not remove the port myself? I'm done with chemo, so I don't need it anymore. Now, if you're imagining this being done with surgical precision or proper tools, think again. This was a DIY job in the most horrifying sense. Somehow, they managed to get the port out of their skin. That alone is dangerous enough, but they didn't stop there. They went further and detached the port from the catheter, the part that connects to their veins, without clamping it or applying any pressure to stop the flow of air. If you know anything about anatomy, you know where this is going. In doing so, they created an open line directly into their bloodstream. This allowed air to rush in, and they gave themselves an air embolism, a pocket of air traveling through their veins to their heart and brain. Within moments, it triggered a major stroke. By the time help arrived, the damage was done. They survived, but the stroke left them with permanent deficits. The kicker? If they'd just waited 2 more weeks, their port would have been removed safely in a sterile environment, with no risk of embolism, infection, or worse. It's heartbreaking and frustrating because this was so preventable. All they had to do was trust the process and let the professionals handle it. Story 16. This story isn't mine, but it's one my family always tells when we're talking about my grandparents. They were 2 of the most practical, frugal people you could imagine, having grown up during the Great Depression. But sometimes that old-school mindset could lead to, let's say, interesting decisions. It started when my grandparents both began showing strange symptoms. My grandpa, normally a spry guy for his age, had turned unusually lethargic. He'd nap half the day away and didn't seem to have the energy to do much of anything. But the real worry was my grandma. She'd always been sharp as a tack, a no-nonsense kind of woman who could juggle a dozen tasks without breaking a sweat. Suddenly, she was sitting in her chair with this vacant, far-off look, sometimes even drooling into her lap. It was heartbreaking to see her like that. Naturally, the family went into full-on panic mode. Was it dementia? A stroke? Something worse? My parents started digging into every possible cause, trying to figure out what was going on. Somewhere along the way, someone connected the dots. Both grandparents had recently been to the doctor and had their medications changed. Maybe the problem wasn't a medical condition, but a reaction to the new meds, or worse, an interaction between the new and the old. So the family sat my grandparents down and asked the big question. Did the doctor tell you to stop taking the old medications before starting the new ones? My grandpa, bless his heart, looked completely unbothered and said, "Oh yeah, he did. But we didn't want what was left to go to waste." Yup. They'd been taking the old meds and the new ones simultaneously just to finish up the leftovers. Because in their minds, you don't throw out something you've already paid for. Waste not, want not, right? Once my parents picked their jaws up off the floor, they gently explained that this wasn't canned goods or leftovers in the fridge. It was medicine, and taking both sets at once could have serious consequences. From that point on, my parents took it upon themselves to check their prescriptions regularly and make sure they were following the doctor's instructions to the letter. Story 17. This one comes from an ear, nose, and throat clinic. And it's one of those stories that sticks with you, not because it's shocking, but because it's so wonderfully human. The kind of moment where you realize even the most educated, seemingly put-together people can have some hilariously basic misunderstandings. A middle-aged man comes in, clearly on edge. He's the nervous type, practically vibrating with anxiety, and you can tell he's been overthinking whatever brought him here. He's well-dressed, speaks articulately, a college-educated white-collar professional. But today he's out of his element. The doctor asks, "So, what brings you in?" And the man launches into his concern. "Well, it's something that's been happening during my showers. When I open my mouth and breathe in the water, I start coughing. A lot." The doctor pauses for a beat, trying to make sense of what he just heard. "Let me get this straight. When you breathe in water, you cough?" "Exactly," the man says, as if he's just described a deeply mysterious, unsolvable problem. "I don't get it. It's really uncomfortable, and it happens every time." There's a moment of silence, and you can practically hear the doctor debating whether or not this guy is pulling his leg. Finally, the doctor says, as gently as possible, "That's called drowning, and it's normal." The man's face goes through a range of emotions: confusion, surprise, and then dawning realization. "Oh, so you're saying that's supposed to happen?" "Yes," the doctor replies, still trying to keep a straight face. "Your body is designed to cough when you inhale water. It's a protective reflex to prevent drowning. It's perfectly normal. In fact, it's a good thing." The man's relief is palpable. "Wow. Okay, that's a huge weight off my shoulders. I thought there was something really wrong with me." As he leaves, probably embarrassed but immensely reassured, you can't help but marvel at the simplicity of the misunderstanding. Here's a guy with years of education, probably excellent at whatever he does for a living, and yet the concept of "don't breathe in water" somehow eluded him. Story 18. So I was working my shift, and as usual, the day started off with the kind of quirky chaos you can only find in a clinic. The first patient of the morning rolled in, a wiry guy with jittery hands and the kind of energy that screams, "too much caffeine" or something worse. We're going through his meds, and he casually drops this gem: "I breathe meth for my blood pressure." Now, I've heard some creative self-medication stories in my day, but this one caught me off guard. I blinked and said, "Excuse me?" He didn't even flinch. "Yeah," he says. "Meth helps keep it low. You know, calms me down." Calms him down? Meth? I wanted to laugh, cry, and call a psychiatrist all at the same time. Later, another patient waddles in, dragging her feet like the weight of the world, or maybe a few dozen sodas, was on her shoulders. She's diabetic, no doubt about it, but when I bring up her glucose numbers, she just shrugs. "Oh, I don't check those anymore," she says. "Why not?" I ask, thinking maybe it's a financial issue or trouble understanding the process. Her response? "The numbers are too high, and I don't like them." Well, I can't argue with that logic. Now can I? If the numbers aren't there, the problem doesn't exist, right? And then, oh boy, there was the thyroid lady. She comes in holding her belly, saying she can't pee. I ask if she's had this issue before. "No," she says. "It only happens when I give a urine sample." Now I'm intrigued. I explain how nerves can play a role, but she cuts me off with this confident proclamation. "No, it's because I have thyroids." I didn't even know how to respond. She said it with such conviction, as if the plural of thyroid was a medical condition I'd somehow missed in school. But the highlight of the day? That came courtesy of a guy who looked like he'd had a rough night. His knuckles were raw, his shirt was torn, and he had this sheepish grin on his face. The doctor, always calm and professional, asks him point blank, "Did you actually stab someone?" And without missing a beat, the guy nods. "Yes." The room goes quiet, everyone bracing for the worst. The doc follows up, deadpan. "Are they okay?" The guy shrugs like it's no big. "Yeah, it was just a little one." A little stab? Like there's a measurement where stabbing becomes casual. As the day wrapped up, I sat there reflecting on the sheer absurdity of it all. The meth guy, the glucose lady, the thyroid expert, and Mr. Just a little stab were proof that truth really is stranger than fiction. Story 19. You'd think, after all the years my wife's worked at the hospital, She'd have learned to sniff out trouble when it came her way. But nope. She's still got that helpful streak that gets her tangled up in the most ridiculous situations. Take this one time, for example. It was late in the afternoon, and she was ready to head home after a long day. Then the front desk called and asked if she could squeeze in one last patient. Tony needed a quick follow-up, something about adjusting a medication dose. They assured her it wouldn't take more than 10 minutes. She could have said no. Other docs would have. They were the clock watchers, the "it's 5 o'clock, I'm out of here" types. But not my wife. She's the kind of person who still says, sure, no problem, even when she knows better. So, in walks Tony. He's clutching a thick folder that looks more like a small novel. She gives him a friendly smile and asks what's going on, expecting him to dive right into whatever minor issue he's having with his meds. Instead, Tony plops the folder onto her desk with a heavy thud. "I've got this Social Security disability packet," he says casually. My wife blinks, already sensing the impending disaster. "It's like 50 pages or something, and I need it done today. Now let me tell you, my wife is no pushover. She's tough when she needs to be." But even she was momentarily stunned. 50 pages? Today? This was supposed to be a 10-minute follow-up, not an all-night homework session. Still, she keeps her composure and asks why he didn't mention this when he scheduled the appointment. That's when Tony drops the real kicker. "Oh," he says, "I had to lie to get in. They wouldn't have let me if I told them the truth. But I can wait if you're busy. No rush." No rush? At 5 p.m. on a Friday? And he's telling her this might take longer than 10 minutes, like it's some shocking revelation. The audacity of this guy! She took a deep breath, probably counting to 10 in her head. She explained, politely but firmly, that filling out a Social Security packet was no small task, and it wasn't something she could just whip up in the time it takes to make a cup of coffee. She told him he'd need to schedule a longer appointment, preferably during normal working hours. Tony didn't get upset or anything, which I guess was a small mercy. He just shrugged, picked up his behemoth folder and said, "All right, I'll do that then." And with that, he walked out, as if he hadn't just wasted the last few precious moments of her shift with his completely avoidable problem. When she got home that night, she looked at me with this mix of exhaustion and disbelief. "Can you believe that guy?" she said, shaking her head.